I'm going to have to go a little quicker. Where we fit in, we're not really insinuating that we're for everybody. There's about 6% of the patients that cost 45% of the bill. And as a result, our system is really designed for those patients to keep them out of the hospital, for payers and caregivers that know that if they're on their medications and they take their medications properly and I can track that, I'm going to reduce hospitalizations. As I said, the medication administration record is available actually 24/7. The physician or clinician can log on to a web portal. They can pull this up. It can also automatically be emailed to the doctor or clinician on a monthly basis, so that it gives detailed on what is the compliance rate of the patient. What are one of the really key features of Emma is that she not only manages scheduled meds, but also PRNs. So, which none of the convenience devices have that capability. They're all usually either nurse loaded or pharmacy loaded. And when there's a change in the prescription, either the whole shooting match has to either go back to the pharmacy or has to be emptied out and reorganized. With our system, you don't have to do that. Also, all interventions are documented so that if there's been a change in the medication, you'll see who changed it and when. There's also numerous other features that are also on there. We're currently looking at, as I said, we're in the military. We're also in the VA, in the polytrauma treatment centers, and the coordinated care. I'm going to jump a little bit to the coordinated care home telehealth. Dr. Darkins is in D.C. is one of the national leaders in this home telehealth. But again, one of the keys is not just information flow, which the telemetry devices, but actually the ability to enact treatment by changing the dosing algorithms and literally titrating patients by individual dosing periods. In the commercial market, we've just entered into the commercial market. We're using pharmacy partners to be Emma pharmacies, and certainly the linchpin in our process is that the pharmacy has to be able to fill the blister card that is compatible with the Emma system. So they end up, we have pharmacies in Michigan and Indiana at this point. We have several here in Pennsylvania, primarily western Pennsylvania, that we're currently in the process of, I would say, the end of discussions. We're also doing a pilot with the New York State Office of Mental Health in 3 different areas. The forensic area, again, they're under legislative mandate to maintain the documented medication administration record, as well as the assertive outpatient therapy and intensive case management. Again, our target population is the 6%. Emma's costs about $10 a day to have in the home. That includes the equipment, the communications, and the servicing. So at $320 per month, it is, at this point, has to be an economic offset. All good ideas, no matter how good they are, if they don't make economic sense in the healthcare system that we're faced with, they don't get implemented. So in our situation, for those patients who are habitual users of the emergency room and their alternative is to go into assisted living or nursing home, we're working actually in discussions with several of the life programs here in Pennsylvania also, because again, we can no longer afford to institutionalize our elderly. We're going to have to take care of them and pay for it and keep them at home. I've been cut, so I thank you very much for your time. And if you'd like to come back and see Emma, I'll be there during the break.
Anthony, thanks, and to all your team at INRange, that's great news, and getting financing in December 2008 is near remarkable in and of itself.